Hello, my name's Tracy and I'm the Recovery Plus trainer here at the Nuffield Wessex Hospital, and we've put together a short video for those patients who are post-op, around about 2 to 4 weeks, those that have had knee and hip replacements. You're going to need some equipment. All you'll need is a towel that's rolled up, especially if you're a knee patient, and possibly somewhere to lie at the end of the video to do some lying exercises. So a bed or a couch. Please only get down on the floor if you're safe to get back up again. All right, so I'm going to rope in some people around the hospital, some friendly faces that you may have come across on your journey with us, and we're going to have some fun with this. So get yourselves ready, and it's about 15 minutes. So important that you continue with these exercises. So if you can do them maybe once every other day at least. Anyway, we hope you have fun. Going to demo your sit to stand. She's our radiographer, and you may have come across her where you had your x-ray or maybe an MRI scan. So what we're going to do is make sure your feet are firmly on the floor, Rachel, and then just stand up for me, and then just sit back down again. Good, and we're going to be doing this for about 1.5 to 2 minutes. Okay? Okay. So do take a break when you need to. Lovely. Making sure the knees don't come together. And then those that want to work a little bit harder, make sure if you take your operated leg a little bit closer to you and the non-operated leg in front, and then continue with your sit to stand, and you're pushing up through your operated leg. Good, keep going. Excellent.
Okay.
Good, again, remember, keeping those knees apart, weight down through your heels. Up you come, Jamie. He's tired already, hasn't done half a minute. Good, keep going.
Okay.
Keep going.
Yes, it's quite clear that Tracy wants me to put the effort in.
Alright, and remember, if you want to work that operated leg a little bit harder, you keep it close and take the opposite leg out in front. So if you want to swap, and then we're pushing down on the right leg, up you come, Jamie, all the way up.
Oh yes.
And down, yeah? You can feel that a little bit more in that operated leg now.
Yeah, I can feel that on my new knee.
On your new knee. Your scar is amazing, by the way.
What's that?
Your scar.
Of course, yes. I'm really pleased with how it's held.
Come on, keep going.
Yes, let's chat. All right.
Alright, so now we're going to do some marching on the spot, alright? So I've got the lovely Victoria, who is our ward manager, and Joan as well, who's our staff nurse, and we're going to be helping you out. So what we're doing on the spot, lifting the knees up nice and high. Good, and again, guess what? Another 1.5 to 2 minutes of these we're going to be doing. Not you ladies. Hopefully you recognise these ladies from when you were in. A little bit more marching on the spot, so just making sure those knees come nice and high, get that nice bend through, standing nice and tall still. Good, look at these lot all in time. Excellent, well done. We're still going with that marching, get those knees nice and high. Who like that, Ollie? You've probably seen Ollie up on the wall with you. So we're still marching, up on the spot. Getting those knees nice and high. Excellent. You must remember Jasmine, she's always up here. She doesn't want to be doing this. I know you don't either. Alright, well done, keep going. That's it. Alright, so your next exercise is going to be some balancing. So I want you to stand on your operated leg, and the lovely ladies from marketing are going to demo for you. Okay, so lifting up nice and tall, as long as you can. If you're finding that a little bit easy, you can take the arms up and over the head and bring it back down again and lower. Now if you get a little bit tired, there's no reason why you can't try on the other leg as well. We need to balance on both sides. How are we doing there, ladies? Yeah. Oh, good. It's hard work. We're going to do this for 2 minutes. We're down a really important part of the hospital, the pharmacy, where Carla dispenses all your medicines. So we're just staying with that, standing on one leg. Remember, if you need to hold on to something steady, hold on to something steady. Good, excellent. How's that feeling, Carla?
Yeah,
You're doing really well. Can you take the arms up to the side? Bring them back down again. Good, can you bring them up in the front? Lovely, excellent. Well, so Hannah's going to be helping you out still with that standing on one leg. Remember, we're going for 1.5 to 2 minutes. And Hannah, you can take the arms out to the side if you want to. Yeah, feeling brave, take them over the head. And back down. And lower. Can you take them in front as well? Marvellous. Good work.
Hurry up, my leg's aching.
Alright, remember, if you get tired, you can always take it down, give it a little bit of a rest.
Do come on.
And then come up again. Alright, there
She's
we go.
alright.
Done. So your next exercise is going to be for your glutes, so more hip exercises. Matthew here is very important in the hospital because he cooks all your meals. And he's going to be helping me to do it. So when you're ready, stand nice and tall. As you take the leg out behind, squeeze your bottom, and then back in again. So again, big squeeze out, and in. Good, keep going. Feeling that working there, Matthew?
Very tight.
Yeah. Take that out. Good, and again, we're going to be doing this for about 2 minutes. With this. So we're still doing those thick hip extensions. And then while Connie's here, I'm going to ask her a question that we get asked all the time. So, Connie, my surgical socks, when can my surgical socks come off?
So, we always say 6 weeks, the TED stockings have to stay on. Normally then, just wait until you see your consultant.
Good. Thank you, Connie. Right, so we're back in reception now, and Maria's now showing you those hip extensions. So keep that leg straight, really squeeze that bottom straight leg, Maria. Come on, straighten it up. Straight leg, that's a bent leg. Straighten the knee, straighten, and take the leg out straight. There you go. So you're really working in here, and then bring it back in, and straight out behind. In and back. Lovely, couple more. Keep going, right to the end. Excellent, well done. Okay, so our next exercise are going to be some step-ups. So you're going to pick your operated leg. So Jamie, which leg have you had on?
I've had my right knee replaced.
We've operated on Jamie because we know that he's been terrorising you in the ward. So he's going to do our step-ups. So right leg up, Jamie, for me.
Okay.
Good, and then bring your left leg back off again. Nope, that was wrong. Right leg on, operated leg on, Jamie. Left leg off. That's it. Now you're going to keep going. Up you go. Nice and slow, nice and controlled.
Nice and slow.
That's it. Keep going. So obviously some of you won't have a step in your house. If you do have some stairs, you can use the bottom stair. How's that feeling, Jamie?
Thank you.
Good.
Compliments are always welcome.
Lovely. And again, we're going to do this for about 1.5 to 2 minutes. Brilliant. Right, so we've come round to reception and we found Kate here, still going with her step. Up you come, Kate, and back down again. All right, use your operated leg, so same leg up. So this is your operated leg up, and then non-operated leg down. Good, and again, operated leg up. Lovely, good. We're going to keep going. Oh, yes. Double 30 seconds, wrong side, operated leg up. Good, and then back down. So remember, always stepping up on your operated leg, leave the operated leg on, and take the opposite leg off. Alright, so your next exercise is going to be for strengthening the hip around the bottom. So you're going to hold on to something steady and we're going to take the legs out to the side and back in. So this is your operated leg, out to the side and back in. All our lovely mid-sex who you've probably spoken to on the phone are all helping you out today.
No one's doing it.
Lovely ladies, out to the side and back in again. Out to the side, get a little bit of squeeze in the glutes. Ooh, yeah. Feel that muscle working. Alright, lovely. So with our leg extensions, we're here in reception with a lovely receptionist. So we're just taking the legs out to the side still and back in. Lovely. A couple more, out to the side and back in. You right there, Julie?
Yes, thank you.
Good. matter.
Keep up, Douglas.
Right, so now we're down in the supplies department, and again another very important part of the hospital, tucked away at the back here. And we're still going with those leg extensions out to the side, so really squeezing. Can we hold it out a little longer, and then back in again, and then do a couple more of these. Ooh, that must mean a delivery's happened. So we'll leave these good people to get on with their work. Alright, so I've managed to nab Paul, our knee expert physio, and he's going to be demoing, what do we call this exercise?
Inner range quads.
Inner range quads. Basically you're going to be squeezing your thigh and lifting your heel off. Use a towel behind the knee, so off you go, Paul. So squeezing really tightly, you see how he's getting his foot off the bed there, and then relax down again, and repeat. So lots of people ask about the range of the knee, they're not able to straighten the leg quite yet. Is that normal, Paul, at this stage?
Very normal at this stage. It's just to continue working at it. We always say that the end ranges will take their time, but you'll get there, you just got to persevere.
Good, alright, keep squeezing that leg for me then, Paul. We're going to keep going for this. Guess how long? About 1.5 to 2 minutes. Good. Alright, so I'm here now with Marie, and we're going to demo some bridging for you. So Marie, if you want to make sure that the feet are firmly on the bed or the couch, wherever you're laid, and we're going to take the hips up into the air, squeezing your glutes as you come, as high as you can, and then lower back down for me. Excellent, Marie. You're going to keep repeating that for us, so slowly up, squeezing, 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 and lowering down. And you're going to keep doing that repeatedly. Rest when you need to, and then join back in. So again, it's another 1.5 to 2 minutes worth of these. How's that, Marie? 1.5? Or 2, if you're feeling strong. Good. Let's do one more with you, Marie, and then we'll see who else we can find. Lovely. Excellent. Good, and lower back down, Kate. So Kate's finishing off the whole video for us with those bridges that Marie was showing you. So we're going to really kind of tighten those glutes up.
They don't have to wear heels to do it.
No, don't do it in high heels. Kate's tightening that bottom, especially for a holiday that she's now having. Good, let's do a few more there, Kate. Really squeeze up, really squeeze. Good. Let's do another 2. And one more. Excellent. Alright, well done everybody.
Oh, easy.
You actually recorded it. Here's camera shy Chloe. She was the lady doing the camera.